have to share for ourselves personally and then to take it to our communities. It's all yours, my friend.
All right. Thank you, Lauren. Thank you, Healthy Seminars, for having me here. Thank you all for joining us. I see you from all over the United States and Canada. I haven't looked at everybody who's attending yet. But I do want to say, yeah, Lauren asked me about a year and a half ago to put together this seminar on burnout. And when we did, I originally was going to put the seminar together just so that acupuncturists and Chinese medicine could realize the tools that they have to treat and prevent burnout. And when I started putting this together, the world changed. So now it has a new meaning. And what I'm going to skip a little bit ahead, but the reason there's a new meaning is because when you get further in this lecture, you're going to see that one of the main intrapersonal causes of burnout is trauma. It's trauma that can't be processed or it has been unresolved. And right now, the world is in a huge state of trauma. And I've been speaking with acupuncturists on some of Lauren's free webinars that he's been doing. So we're in an excellent place right now to understand how trauma is stored in our physiology and how we can actually help patients process trauma. Because when the world starts opening back up and you're going back into your clinics, you're going to see a lot of traumatized people. And if this is not dealt with, then we're going to have a society 2 to 4 years, 2 to 5 years from now that's completely burnt out. And burnout for conventional medicine practitioners is very difficult to treat. And the reason I titled this talk, The Needle in the Haystack, is because the needle in the haystack, what it's saying is that there's a situation that's impossible or extremely difficult. That there's an area of a body of work, the haystack, that is so large that it's difficult to find the needle in the haystack. And you need to find that needle because if the needle stays in the haystack, then it's going to kill an animal when it goes to eat the hay. And that's kind of what's happening with us right now. The trauma is going to be stored in our body, and we have the needles. We actually have the needles to address it. We, as Chinese medicine practitioners, all we need is the knowledge that we already have in understanding how trauma is stored in the body, how blood holds the trauma. So you're going to hear me talking a lot about low vessels, a lot about extraordinary meridians, because we actually have every tool that's needed to treat trauma and burnout. But Western conventional medicine doesn't, because you'll see when we go through the history of burnout and the theories of burnout, it's holistic. You have to understand systems, you have to understand how the system interacts in society, and then you have to understand how energy works. And we already have that. So the good thing is you already have the tools. My fear is that I'm not going to teach you anything new that you're going to learn. And I know when I say that, people are like, I just signed up for a 4-hour seminar and I may not learn anything. But what you are going to learn is how to think like a person who works in burnout syndrome or in the field of burnout or in the field of trauma so that you can prevent the burnout. So I'm going to give you a language that is specifically for the areas that we work in when we're trying to prevent and treat burnout syndrome. And again, it's very difficult for conventional medicine practitioners to do that because they're not generally holistic. So the needle in the haystack, here's the way it's going to go today. Let me take control of this. Here we go. And let me be able to read down here. So here are my official objectives for you all. I want you to understand the historical development of burnout syndrome as a semi-diagnosis, and we're going to go over that. So the first hour of this whole lecture and workshop is actually understanding the historical significance of how burnout developed. And it's very important because we're back. We're back in the same place right now of when burnout originally developed in theory and in the West. So the first half, we're going to understand the historical development. And then you're going to learn to identify the signs of burnout using Freudenberger's 12-stage cycle. So this is another reason conventional medicine practitioners have a hard time, because we're actually going to be looking at a 12-stage cycle of how burnout develops. It's much like the 5-element cycle. So it's all about balancing energies. And in conventional medicine, instead of cycles, they look at phases and stages. So it's like, it's hard for a conventional medicine practitioner to understand that you can have all 12 stages of a cycle happening at once and transitions. And you may be a little bit in phase 2 and a little bit, it's kind of like you may be a little bit metal and wood comes in and earth and fire and water. We already understand that. So you're going to be ahead when we go through this 12-stage cycle. Second hour of the course, you're going to become familiar with some commonly used burnout inventories. So how to measure burnout and how to differentiate burnout. The problem with burnout too is a lot of people don't even know what it is. And so it's misdiagnosed as depression, anxiety, and stress. So a lot of patients will come into you that are very stressed, very anxious, and have been diagnosed with depression, and they're on medications. And the medications are to treat depression, but they don't treat burnout. And so the patients don't get better. And so it's very important for you all to realize that there is this system, this syndrome of burnout that's out there. We're going to look at conscious self-awareness inventories so that patients can learn how to access their strengths and their values. And we can look at it from a kind of a Western positive psychology system. And we're going to look at it from 5 elements. Then we're going to look at how to prevent burnout syndrome using Chinese medicine diagnosis and theories. You're going to learn mechanisms of how acupuncture and Chinese medicine can treat burnout effectively, and how to administer combinations of points. Sorry, I got to see my screen, so I'm going to minimize you all a little bit. So at the end of today's lecture, the last hour, we're just going to be looking at acupuncture point combinations for the various stages of burnout, and also herbal formulas that are commonly used. We're also going to look at awareness exercises in the beginning, because the way that I laid out this workshop is I've been working in the field of consciousness studies and positive psychology since 2003. So people in this field of medicine know me as an acupuncturist here in Richmond, where, like Lauren said, I treat a lot of women's health issues. But I also wear another hat where I've taught in university settings. I teach people thinking skills and positive psychology. And for years, I taught students in a course where we were trying to get them to be optimized as a student. And what you're going to be realizing is burnout is all about learning what your strengths are so that you can optimize those strengths in order to have a career and a life that's satisfying and is with integrity of who you are. And so that's what we taught for years in this university in Richmond. Okay, here we go. I'm learning how to work this. I'm not the best with technology, but here we go. So we're going to go back to the history of burnout. We're going to start here. But first, I want you to know how common burnout is. Now, here is a difficult aspect of burnout that you're going to find, is that one, burnout is very subjective. So you can ask a person one day if they're burnt out and they say yes, and another day they're not. So it can be up to their mood. Two, most people don't know what burnout is. We know what we think burnout is. So when you ask a person if they're burnt out, one day they may say, oh yes, and the next day, oh no, depending on their mood, and then they're not clear what burnout is. When we get to measuring burnout, the measurements say, are you burnt out? So you have people self-diagnosing themselves with burnout, and they're burnt out on a bad day and they're not burnt out on a good day. So I kind of don't pay that much attention to the statistics, but it's becoming very common that people are saying that they're burnt out. 7 out of 10 people said they've had contact with burnout. 5 out of 10 people, so half the people said that they felt so much stress that they burnt out. people were beginning to take burnout seriously. Throughout history, they did not. So 8 out of 10 people right now take burnout seriously. And I want you as practitioners to learn to take burnout seriously too. And that's why we need to learn exactly what is burnout or how it's defined in the field of treating burnout. So it's beginning to be taken extremely seriously. But I want you to understand the history of burnout in the West, and then kind of how it moved to Europe, because burnout is viewed a little differently in Europe than it is in the US and Canada, in that it actually, in some European countries, has a diagnosis where you do not have to go to work if you've been given that diagnosis, and we're going to talk about it later. We do not have that here in the US. But historically, burnout was first used in a clinical setting in the 1970s. There was this psychologist in New York City in the Lower East Side named Herbert Freudenberger, and he worked with drug addicts. I don't know how much you know about the Lower East Side in Manhattan, but in the 70s, it was a huge area for heroin and a huge area for people to run away to and become drug addicts and bow out of society. And those drug addicts started using this term burnout when they had had long-term exposure to the drugs, and the drugs were no longer helping them fulfill what it was that they wanted fulfilled, and they just started burning out and losing a connection to society. Well, Freudenberger, he was working with these drug addicts, but he was also working in the free clinic in the East Village with the psychologist and the nurses and the doctors who were working with the drug addicts. And he realized that the secondary trauma, or the primary trauma from working with these drug addicts, started affecting the workers. And the workers started having the same signs and symptoms as the drug addicts. They started feeling like they were burnt out. Independently and simultaneously, Christina Maslach and her colleagues at University of California, Berkeley, were experiencing the same term when they were working with social workers and nurses and doctors who were performing demanding jobs. And they wanted to develop a way to measure and assess burnout, because Christina Maslach, I'm bad with names, but Christina Maslach said, well, we need to measure this, because she is a researcher, and she's still a researcher today. I think she's retired from University of California, but she still works there as professor emeritus. She's been in the field since the 70s. So independently, her and her colleagues were also hearing the term burnout. And she developed the most commonly used assessment tool for burnout. You need to know this, the Maslach Burnout Inventory. And she started in the field of healthcare, education, social work, psychotherapy, legal services, law enforcement, because originally they believed that burnout only happened in the helping professions. And again, it was because they felt like these people were being exposed to trauma and secondary trauma every day while they were trying to help. So the original assessments in the 70s and 80s were only for helping professions. The scientific community did not buy into burnout in the beginning. They said it was pseudoscientific, that it was a fad, that it was pop psychology. Some people still don't buy into the concept of burnout. The medical industry and the scientific industry buys into burnout more than some of the occupational industries. And we're going to talk a little bit more about that later when we're measuring burnout. But in the beginning, it was pseudoscientific until Christina Maslach started doing more and more research and seeing that it wasn't just the health fields, the human helping fields that were being burnt out. They were discovering that blue collar workers were being burnt out too. And what they determined in the beginning is most of the people, and this is really interesting, that most of the people who burnt out, when they were only looking into the helping fields, they were looking into people who were highly educated, because generally you had to have a master's degree or above to be a psychologist. or sociology, working in social work. And so it started becoming a field of higher educated human services professional. And so, because these were highly educated people, it became termed as a normal response to an abnormal situation. So, they didn't really want to diagnose helping professionals with some sort of mental illness or incapacity. So burnout started being seen as a normal response to an abnormal situation. So being burnt out, they would say, you know, it's normal for you to be burnt out if you're going to be working with drug addicts every day. It's normal for you to be burnt out if you're working in prisons. But people started wearing um, that as a badge. And so it became kind of a fad to be burnt out. But the prevalence, and this is really interesting to me, and I added this slide in because, as Lauren said, where we are now, when we originally